Catherine.
Good morning, everyone. Thank you so much, Kimberly. Can you hear me okay?
Yes.
Okay, great. Good morning. I'm so pleased and honored to be here this morning. My name is Erin Roman. I would like to thank the Canadian Cancer Survivor Network for having me here today, for my team at InspireHealth for all of their support, and of course to the patients that I have had the pleasure of seeing that have brought just so much knowledge and wisdom to my practice. Today, I wanted to do a little bit of a different kind of presentation when we're looking at nutrition. So I wanted to take a bit of a step back and look at the reasons for the food choices that we make and what can affect those food choices, especially after a cancer diagnosis. First, I just wanted to introduce you to our organization. So I work for InspireHealth, Supportive Cancer Care. We support anyone with a current or past cancer diagnosis or those at high genetic risk, as well as supporting their families and support people to play an active role in their own care. Our programs and services emphasize evidence-based lifestyle approaches that really support the quality of life for adults with a cancer diagnosis. We are a nonprofit and we were founded in 1997, making us 22 years old this year. We are partially funded by the Ministry of Health, and then our other funding comes from donations in the community that we use for all of our classes and programs. So we have 3 physical centers, one in Victoria, one in Vancouver, and one in Kelowna, BC. As well as we have a thriving and we are building our virtual center. So please feel free to visit our website. Through our virtual center, we can also see patients across Canada via telephone and video. We primarily see patients in BC, but we do have the ability to see patients outside of BC as well. We have an interdisciplinary team at InspireHealth, including our physicians, who are MDs and certified as family practitioners. They're meant to be an addition to your current medical team, not to replace any of your team members, but in addition to. We have a wonderful clinical counseling team, exercise therapists that provide our exercise programs, one-on-ones with patients, as well as some yoga classes in our centers as well. And then we have our nutrition team, which is comprised of registered dietitians and nutritionists. All of our clinicians provide self-referral, one-on-one consults with patients. We do accept referrals from other clinicians, but just so that you know, as a patient, you can self-refer. So historically within our medical system and the cancer care model, this is what we maybe would have seen or a patient maybe would have experienced within the system. It was a very cancer-centered diagnosis approach and treatment model, being given treatment options, and then usually the patient experience was a one-way relationship with their doctor. And through InspireHealth, since its inception, we've had a supportive cancer care approach, which we're also seeing being broadened and being spread throughout all healthcare systems and support programs. So this is a wonderful shift to see, where the patient is really at the center of their care, with treatment options, of course, being offered. And alongside of those treatment options, we're also looking at all the lifestyle factors that contribute to well-being. Within the care model, the patient is really, again, at the center and feels supported through collaborative approaches with their clinicians and their medical team, and that the medical team themselves are also talking to one another about that person's care. We really see this as a way to really support the whole person going forward, and especially in a cancer-centered model. And this is also something that we're seeing more so in other chronic conditions like heart healthy programs, as well as diabetes care. There are many nutritional considerations that we see when we're meeting with patients with a cancer diagnosis. We can support patients through side effects of medications and treatments. Some patients do have side effects from their medications and treatments, and some don't have the same side effects from their medications and treatments, but we're here to support any and all of those considerations. We're also here to support energy and immune functions. So a lot of patients that I see come through our doors are having issues with their energy, low levels of energy, and also they have some concerns about their immune function, whether they're currently going through treatment or a past treatment or a past surgery as well. So we're able to support them with food and nutrition as part of that treatment of looking at that immune system and boosting that energy as much as we can. During treatment and surgery, there are specific protein and energy requirements that a patient might have. So we're here to support that. We do get referrals from oncologists, say for a patient that is going in for a treatment that may need to gain some weight after losing weight after a diagnosis. So we're here to support that, as well as looking at specific requirements that they may need as well. Certain conditions, especially with certain cancer diagnosis, do have specific nutrient and dietary requirements. So an example of this might be a patient that I've seen that has come through post-surgery, potentially for ovarian cancer, that we are looking at some concerns around. Maybe there might be some adhesions in the intestine, and that we want to make sure that there's no chance for blockage. So that patient typically has the ability to see an inpatient dietitian in the hospital, and has perhaps been recommended that they follow a low fiber diet. That patient can then come and see us when they've come out of the hospital, and we can help to tailor that diet to see how that diet can best work for them, as well as how long to stay on that diet. And then if it's time for them to come off of that diet, we're there to support them in terms of adding in a little bit more fiber, as an example here. On top of all those nutrition considerations, there's all of those biopsychosocial factors as well. So let's break that down a little bit as a bit of a buzz term. But it's really important in our practice at InspireHealth in terms of nutrition. And it's one of those things that when we have the time to really delve into it, it can really have lasting effects on a plan for well-being going forward. So there's so many other reasons that we eat besides calories and nutrition and protein and hunger. There are many factors that also affect why and how we can also eat. So this is more of a model looking at mental health, but mental health of course plays into our food choices. Biologically speaking, genetics can affect our health, and therefore those health circumstances can affect our food choices. So say we may be dealing with other chronic conditions such as diabetes or heart disease, or we may have a physical disability that may be affecting why and how that we're eating. Socially, there are many reasons why we eat and that are affected by social factors. Culturally, what foods are appropriate for us. Celebration and ritual that are involved in food practices. What are our family relationships and our family dynamics like? Is there someone in our family that's following a specific diet for certain reasons that then is affecting the way that the rest of our family is eating at the time? Psychologically, have we been dealing with any kind of stress or trauma? How is our stress? How is our sleep? At InspireHealth, all of our clinicians really look at both stress and sleep. And I have many patients that say, Erin, what does this have to do with my nutrition? Why are you asking me how I'm sleeping? And it's really crucial to our overall well-being, and we'll look at that a little bit further later. But this is just an example of just looking at all of the factors that sometimes we don't have time when we're just post-surgery and we're in the hospital to really look at, like, why am I choosing the foods I'm choosing, or how can I choose different kinds of foods in my diet, and how would that support me on all of these levels and not just from a calorie or energy basis. When we're looking at those psychological factors that can affect our food choices, we also really need to look at what our relationship with food has been throughout our lives. Have we had any kind of patterns in our food choices in our life? How have we dieted in the past? Have we restricted food in the past? Have we had a healthy or unhealthy relationship with food in the past? I find that this is a lens that we don't always talk about with our clinicians or with our healthcare team, and it's really, really important going forward. It really can bring us back to seeing the patterns and why we go in the direction that we go, and how food is actually making us feel, and that there might be something underlying why food is making us feel a certain way. It's absolutely normal and very common for a patient that has had a cancer diagnosis to then have an effect on our relationship with both our bodies and with our nutrition. So I just want to take a minute there, because if we have had in the past any kind of patterns around food, and even if we haven't in the past had patterns around our food choices, to have a cancer diagnosis can really sometimes put us into a tailspin in terms of what's going on in my body. Why is this happening in my body? Was it something that I ate? A lot of patients that come through my door, because it's one thing that we can associate with how we're feeling is food, and then that blame and that shame really comes up for patients around food and the cancer diagnosis, even though cancer is such a multifactorial disease, and we cannot attribute one food to receiving that diagnosis. And it is one thing that we feel like we do have control with. So I see a lot of patients that end up having a lot of anxiety and stress that can come up around food and what they should be eating now after the diagnosis. So I really see that our role as a nutrition team at InspireHealth is really to try to bring that stress down, really explore that anxiety, and see what would work best for that patient. So sometimes the history of that food relationship, if we've restricted in the past, we might decide to restrict now, and that can really have an effect on our overall well-being. That trust in our bodies and in what food is doing for us can also come into question, and that's something that we would also like to support. If you go to Dr. Google, as I like to call it, and you searched cancer and nutrition, you would find 586 million hits. If you Googled cancer and food, you would come up with 870 million hits on the internet. There is an overwhelming amount of information that is coming at us every day. You might find in your social media feed that if you've searched food and cancer or diet and cancer, that all of a sudden you have all of these ads for detox teas and this book about a cancer protocol and nutrition. And even as nutrition professionals, we find it overwhelming to keep up with the amount of books and websites that are coming out now, and all the different recommendations that various people are making. So just to know that that is absolutely normal to feel overwhelmed with that kind of information coming your way. Within a clinical setting, most professionals don't have a lot of time to spend with a patient. And so when guidance is given, even though it's well-intentioned and with the best of evidence behind it, and then to come to a supportive care environment can be really beneficial in terms of bringing that relationship with food with you, bringing those feelings of any kind of anxiety or that feeling of overwhelmed with you to your appointment to really discuss with us how things are going for you and how we can really look at what would work for you individually. I actually want you to take just a minute and think about the last time that you had a meal that was pleasurable for you. What were the circumstances that surrounded that? Were you on your own? Were you eating with others? When was the last time that you didn't look down at your plate and judge what was in front of you? That there were positive messages coming to you about the food that you were having, and that really there was a sense of calm. That's not a common situation for most of us, especially after a cancer diagnosis. So again, I just want to normalize the fact that those feelings that come up are very common, and we can definitely work with you on all of those feelings. When we have that sense of overwhelm, we tend to think of ways that we can control rather than ways that we can add foods to our diet. So we'll get into that a little bit. And I found this quote that I thought was quite interesting. So eating serves not only to ensure the intake of energy and nutrients, just like we were talking about, but has an important role in maintaining psychological balance by providing pleasure. So isn't that interesting? We tend to work in our own fields of exercise or nutrition or mental health or medicine. And I love this quote because it really talks to that relationship between eating, so not just food choices, but eating, how we're eating, what we're eating, and really like our well-being and our psychological balance overall. Stress is a very normal function of our body. We all experience stress in various ways. And we all know that stress can contribute overall to some conditions within our body. Acute stress is something that we feel all the time. When was the last time that you felt that pang or that churning in your stomach when you were nervous? I know for myself it was this morning, right before this webinar. And it's interesting because stress and our gastrointestinal system, our digestive system, are very intricately tied together. And this is something that when we're looking at having a cancer diagnosis and then being presented with treatment options and lots of appointments and going in and out of your house and being in different environments for eating, that can really affect our bowel movements, can affect the way that food is making us feel, the speed even at which we're eating at times because we're on the go. So I wanted to look a little bit at the role of stress and nutrition and why, as an organization and as a nutrition team, that we really do promote stress reduction strategies. So our immune function is super important. I think we've all heard this in the past, and I'll think about vitamin C and our immune function or fighting a cold. But when we're talking about our journey with cancer specifically, when we're going through treatment or surgery, our immune function can be compromised. So there are some things nutritionally that we can look at, as well as our digestive system overall. I do see a lot of patients that are coming in after having been given a diagnosis that all of a sudden they're having lots of constipation or they're experiencing some diarrhea, and that might be symptomatic of something else. But also when we look at it, a lot of times it can be tied to that stress that is kind of chronically happening due to diagnosis and treatment and what's happening currently in life as well. If we currently have any inflammation in our bowels or in our intestines, so I'm thinking of patients that may have previously had IBS or Crohn's or even any kind of food aversions, sometimes we see that exacerbated a little bit during this time as well, and that's something that we're happy to support you with. So stress can affect our food choices, and then our food choices can also affect our stress levels. So again, it's a relationship here that we're talking about and that we really like to explore with patients. So we know that we can have those digestive effects from having that chronic stress. And then also if we're not feeding our body some foods that can help with those feelings, then that can exacerbate a little bit of the stress even more. And not to say that food is the only way that we can look at stress. It's definitely a multifactorial approach as well. Within our team, we really like to look at having like a whole program. So you have access to talking about nutrition, as well as talking to our counseling team, as well as our MDs and our wonderful exercise team as well. We know that stress can be approached from various lenses and various approaches as well. It's very common when we look back at that trust with our bodies and trust with foods that I see patients that whose anxiety levels raise a little bit when we talk about food or trying to decide what to eat. And it can go a route of trying to make choices that are perfect choices, or the buzzword of clean choices, or good or bad, attributing good or bad to certain foods. And we actually see that when we get to a point when we are trying to make perfect food choices, which is very common after a diagnosis, that can actually lead to more stress. one of my recommendations would actually be to go back and watch Dr. Rob Rutledge's presentation for CCSN that he just presented, The Fear of Cancer Recurrence. I went and watched it myself yesterday. I've had the pleasure of co-hosting with Dr. Rutledge in the past, and his messages around anxiety and reducing stress are so applicable to all patients, and I think they would really marry well with our approach with nutrition as well. Some of these approaches can include movement, whatever joyful movement means for you, social time, yoga and meditation, deep breathing, and really focusing on your sleep as well. So again, sometimes I see patients that are coming through and their approach is to focus solely on food. And when we do this and we're not looking at our overall well-being, it really can add to those stress levels and that anxiety because there's so much emphasis on one area in our lives. So this is a beautiful image of beautiful foods, really from around the world. And this is a message both for clinicians that may be tuning in this morning, as well as patients. I know that we know the whole message around eating the rainbow, which is represented here, and how there's lots of nutrients and those dark colors and in all the multitude of colors in our fruits and vegetables that we have. And this image itself, even though some of us may say, oh, that's beautiful, lots of nutrition, perfect. And then some of us, this could be quite overwhelming. There are a lot of different fruits here that not everyone has tried before. I'm from a very small town in the Maritimes. I grew up in the Maritimes, even though I live in British Columbia now. And many of these foods I had not even seen until I was maybe in my 20s and I moved out of the Maritimes actually. My little town, we didn't have access to many of these foods. So I just want to bring up the appropriateness of messaging that we give around nutrition. We don't have to have all of these different foods in our diet, and it's more so about simplifying and not feeling so overwhelmed that you have to have all of the foods that are pictured here included in your diet. And we're here to help you come up with a plan where you can get tons of nutrients in foods that are accessible and available to you. So what does supportive nutrition care even look like? I find that not everyone even knows the role of a dietitian or the various roles of dietitians and nutritionists within our healthcare system. I feel that I'm very fortunate to have the capacity within my role at InspireHealth to offer supportive care. So what can this look like for you, and why do I feel that it's so important? We have time. So our initial consultations with patients are 75 minutes, which is usually not even enough time for some patients when we start to look at those biopsychosocial factors. We can really explore and look at what is happening currently in a patient's life and in the past if they're comfortable, and creating an openness and building a trusting relationship with patients. So if you're a patient coming to me, I want you to know that I'm here to listen, and that even it doesn't have to be about nutrition at the time, that I'm here to really look at what's happening for you in life at the moment, and how can we look at that as a whole approach to well-being, and including nutrition within that plan, and that it's really coming from you. It's really patient-centered is what we're doing. It gives us time to have an appropriate message, so it's not just a handout that is like this is the diet. It's more so a conversation and looking at what your goals are and what's available to you and what your hopes are for how you would like to feel. We can explore some stress reduction strategies, especially in regards to how food and food choices are making you feel, but also overall because we have access to our interdisciplinary team, which is so beautiful. We also have the ability to have consistent follow-ups if necessary. And I put if necessary there, although most of my patients I follow up with their choice to follow up. We can have 45-minute follow-ups with patients, And that can be either in person or over the phone or over a video platform as well. I feel this is really, really important, especially with our population. There are many different nutrition factors to consider if we are pre-treatment, going through treatment, post-surgery, and then long-term, what's right for you and for your family. So this changes in terms of time and our current situation. So that's one thing that we are able to provide with supportive nutrition care. We also have that ability to see what is happening with you over a period of time, and if more clinical expertise is required, we're also able to make an appropriate referral. So it's nice to have this team of clinicians that are seeing you through and are able to connect you as well with other resources in the community. So just a little funny comic. Dear, I'm waiting that you don't go back for seconds. And as comical as this can be, I thought it was also a really great representation of what are very, very well-meaning friends and family members who are potentially perhaps giving you some nutrition guidance and advice. Nutrition seems to be that common topic that is seems to be open and available for everyone to be able to give some advice and guidance in, and that's very, very common. So I do find that having a trusting and long-term relationship with our team allows for not only for us to support you in terms of perhaps creating some boundaries, because it can be overwhelming for someone to be getting so much advice, and sometimes that advice is quite pressing. And also I find that patients feel it's supportive to be able to acknowledge that information and say, you know, thank you so much. And I do have a team and a dietitian that I talk to on a regular basis about nutrition, but thank you so much for that guidance. And that can sometimes go a long way for someone, just to know that they have a filter. I like to say that, let me be your filter. If there's 800 million hits on the internet, let me be your filter for that. So bring me questions, bring me websites, bring me books, and we can discuss. So practically, let's talk some practical supportive nutrition guidelines that I would say in general, because there are some individual messages that patients do receive in terms of where they're at in their care process and in their treatment process. And there are some general guidelines that we tend to see coming up in most of our consultations. Adding more foods and not less. We have been surrounded by a culture of diet for a very, very long time. And that diet culture has really encouraged restriction of foods. And so most folks that I've talked to, when they come and they would like to talk about nutrition, they say, what shouldn't I eat? What should I stay away from? And instead, we try to reframe that approach to what nutrient-dense foods can I add? So yes, there's lots of great evidence-based research out there that has benefits of foods at this time, and we can look at that and how can we add those in, and are they appropriate for you at this time? Also how much to take and or how much to eat, and also when to eat, and all those kinds of things, and how to combine them. And that gets into a little bit of a talk of blood sugar regulation. I always say to my husband that I wish that we would have learned about blood sugar regulation in elementary school, that it was part of our curriculum. But basically, when we're talking about blood sugar regulation, this is for all of us, just in terms of looking at, we know that if our blood sugars get too high or if they get too low, sometimes we feel that. We feel those highs and those lows in our body, and our body asking for either more food or asking for to like calm our system down a little bit. But we do know that those environments, when our blood sugar is too high or too low, can lead to effects on our mood and on our energy, and sometimes on some inflammation markers in our body as well. So we're here to support patients through what that looks like for them. How can we keep those blood sugars pretty regular through the day? And that just usually looks like fairly regular eating, making sure that we're eating every 3 to 5 hours, depending on the person, and that when we are eating, that we're having a nice combination of foods when we do eat. Within those messagings as well, we touch on topics like incorporating healthy fats. We know there's lots of benefits for our mental health and for our overall health, incorporating those omega-3 fats, those nutrient-dense foods. What is that? What does that look like? Most people are like, please don't tell me I need to cut my coffee, or I really don't like quinoa. Do I have to eat it? And so we have those conversations. Protein choices. These days, there's lots of questions around protein choices and how to fit those in. The most common conversations I find myself having around protein choices these days is if someone has decided to make a shift in their diet, knowing how to replace the foods that they've decided to change in their diet and making sure we're getting enough nutrients in at each meal. Fiber and hydration, we always focus on as well. We talk about, you might find that during your journey, you may have ads that have popped up around detoxes or detoxification and detox teas and all those kinds of products, which can have lots of side effects and usually are not recommended, those products. And thankfully, we have our own natural detoxification process, which is through hydration, making sure we're nice and hydrated through the day, and then also fiber. So some people get uncomfortable chatting about this, but we're very comfortable talking about bowel movements in the nutrition team at InspireHealth. And fiber, different kinds of fiber are suitable at different times in your journey. So at times, you may need less fiber and a more low residue diet, as we discussed earlier, say in ovarian cancer or any kind of colorectal or gastric cancers. Fiber is something that we kind of play around with to see how you're feeling and to see how your body is adjusting to those different levels of fiber. And that's something that we would definitely help to guide you through. A focus on overall nourishment. So when we think about nourishment and food and energy, we just think about food, but it's that bigger picture of well-being and what is nourishing our body, what's nourishing our mind and our spirit at this time. And they're all interconnected. And the more that we nourish our whole body, the more that we'll see a positive result in the end, especially in terms of our energy levels and our mood as well. Kindness. So we eat 3, 5, 6 times a day. And I think it's such a beautiful opportunity to inject those positive messages during the day. It doesn't really matter what's in front of us in terms of food, but looking for the goodness within it. As Dr. Rob Rutledge said during his presentation yesterday, if I can remember, your brain really remembers what you keep practicing, and it gets better at the things that you keep practicing, which makes sense. So if we were to inject those positive messages when we take that time to eat every day, then it can really help with our confidence and really address some of those anxiety levels around food choices, because instead of blaming or shaming around what we're eating, we're really turning that around and reframing it into a lens of, wow, I'm nourishing my body. Wow, I'm having some vitamin C in this orange. That'll be great for my immune system. And if you need help with those messages, we always like to help with those messages as well and have some reminders around that. Reaching out for one-on-one support is a positive message in and of itself. The fact that you are at a stage of coming to see someone, whether that's our team or whether that's someone within your own community, and whether that's another clinician that feels like the right fit for you, do reach out for that one-on-one support, because of the fact, especially now with so much information that is coming on our computers or in our magazines and even passing by on a bus. There's so much information that to meet with someone one-on-one can be really beneficial. Don't be scared to ask for help from friends and family. This is quite a big one. Friends and family want to help. And sometimes that help comes in form of nutrition guidance. A way that we can, again, reframe that situation is to ask for help with cooking or ask for help with food. There are some great apps out there. like meal train apps where folks can sign up to bring you food. And a way that you can have a bit of control in that is, if you need to feel a bit of control in that, is to find some websites, find some recipes that you're comfortable with, and send them to your friends and family. And I'm sure they would be happy to help in terms of nourishing you through food at this time. It's one of the really beneficial and easy ways for someone to actually do something tangible to help you. So we talked about creating peace, or towards creating peace with food. And I think the towards is very key in this messaging, because it's not about perfection. And the term peace may come with a connotation of perfection. And really the journey here is the destination. So it's just going towards that sense that will really have benefits overall. So I want you to think of a place, or a thing that you do, or a place that you go that really brings you a feeling of calm, and or a feeling settled, or some peacefulness. For me, it's the ocean. So for me, if I'm having a period where I'm feeling really overwhelmed, or I'm having that shallow breathing happening because it's been a week, or it's been a day, or something traumatic has happened. For me, it's the ocean. I go to the ocean and I can immediately feel my breath go down to my belly, and it slows, and my head might not clear fully, of course, but it feels a little bit clearer than it was when I first arrived. And that, we can't always be in that place. You know, life continues and things happen, and every day we have different factors that come up in our lives. And to be able to bring that sense of settlement is what we're looking for when we're looking at food, is my goal and my hope for patients that I speak with, as to let go of some of that anxiety, let go of some of that blame that we carry, and that food again can somehow become enjoyable. I realize that especially after a cancer diagnosis, especially if our energy levels are low, we're not feeling our best, we're having any kind of side effects, that to step into a kitchen and decide what to eat can be quite overwhelming. And we are here to support you through that. And we've talked about some of the strategies, but here are a few more. So an acknowledgement that emotional eating is very normal. So we all eat emotionally. There's nothing bad about eating emotionally. It's more so noticing when we're eating emotionally, what we're feeling, and how we can, again, move towards more of a feeling of peace and calm. And perhaps there are some foods that we can have that bring a bit more of that sense to us, and or what else can we do that can bring us peace at this time? Again, it's very normal, and all of us, for both positive and negative reasons, decide to turn to food at various times in our life, whether that's for celebration, or whether that's after a trauma, or after a diagnosis. So we're definitely here to help you through that, especially with our clinical counseling team as part of that as well. And as a part of that as well is to move away from that feeling of good and bad foods. We like to look at the 80-20 rule. Excuse me. So let's have a sip of water. The 80-20 rule. So when we're looking at overall, 80% of the time, might be less than that. You know, we might even be at like 50-50. We might be at 30-70. Who knows where we're at currently? But to feel like the whole 80-20 rule is to look at, it's not going to be perfect all the time. And what we've seen is, if we tend to move towards perfection with food, is that can bring us more stress. And we really want to try to move away from the stress and anxiety as much as we can. So yeah, so let's look at, most of the time, we're looking at some foods that make us feel good, some foods that have some nutrients in them that we know are those great building blocks in our system. Food can be so powerful and a piece of our journey. And then there's that other piece of time where it's a celebration or it's a food that we really enjoy, and maybe it doesn't have a ton of nutrients, but it probably has some. And to focus on the positive messaging during that. So again, letting go of that good and bad. Noticing how food is making you feel. So this is beyond some food gives us a little bit more energy. Some food sometimes makes us feel a little bit more bloated, or sometimes we get some constipation. It's actually beyond that. It's also noticing if it's giving us those feelings of good and bad, and trying to let go of that judgment, and trying to look for those opportunities to feel good when we're eating. And what that looks for each one of us is very different depending on where we're currently at. So that might mean if we're at a point where we don't have much of an appetite, we're having a hard time getting food in, we're having some shakes or smoothies or boost or whatever we're currently having to get the nutrients in, maybe we put it over ice in a nice glass, and then that makes us feel a little bit better in the moment about the amount of food that we can get in. Again, we're here to support you in terms of getting in the nutrients during the day, but this is more those like taking that step back and realizing that this is something that we do so many times a day, that how can we create a positive environment for it. You are more than what you eat. For so long we had that message, you are what you eat. And we're more than that. We're feelings, we're emotions, we are our physical bodies, we are movement, we are also the events that are happening in our life at the moment. So just giving yourself a bit more softness and a bit more kindness, and some room around food. Again, of course, there are very nutritious foods that we can include in our diets, and having that softness, having that space, and finding joy in food again, finding joy in experiences around food. Talk to yourself like you would your best friend. If your best friend is ill, we're so kind and so compassionate and so loving with our best friend. We would bring them chicken noodle soup, or we might bring them, a smoothie, or we just say rest, have these foods, eat what makes you feel happy right now, eat what you can. And then when we turn the table and it's us in that position, oftentimes we go to a negative place when it comes to our health and the foods that we're consuming, and we could always do better in our minds. And so again, it's that concept of reframing and talking to yourself like you are compassionate and loving with yourself, especially in regards to food and your health and your body. When and if possible, and this isn't always possible, eat with others. When we eat with others, whether this is in a cafeteria or whether this is down the hall with a neighbor or with your friends that just moved down the street, or your family, or you call up an old friend that you haven't talked to in a long time and you eat with each other over the phone even. There are so many benefits to conversation and having that spirit of others around you when we eat. And it's how we make connection. It's enjoying food together. It's getting away from thinking about the negativities during the day, and it's just it's bringing back that pleasure in food that societally sometimes we've often, it seems like we're missing at times, and even that connection that we seem to be missing. I love this Jamie Oliver quote. Nourish to me is nourishing food, nourishing your family, and nourishing your life. So again, it's that concept of, if we can, finding some kind of pleasure in food and in eating. It's not even just in the food, it's in the eating process as well. I find being busy as well, and if it's a day that hasn't gone that well, or I'm not feeling that well, that food doesn't always have pleasure, and it doesn't always have to have it. And if we can find joy again in food, if it's something that we've lost, I think it can really contribute to our sense of connection with others and trusting our body again, and really finding that positivity in really, we're all trying our best, and acknowledging ourselves for those efforts that we are putting in, and how we can nourish our body and our mind and our spirit in so many different ways. So at InspireHealth, I mentioned that we do 75-minute personal nutrition consultations, and then we do 45-minute follow-up sessions. And so this can either be in person at one of our centers or through telemedicine or video conference. We also offer cooking classes and nutrition workshops. Of course, those are at our physical centers in Victoria, Vancouver, and Kelowna. And then we have online resources as well. So we have a ton of recipes online. We also have videos. And I'm happy to answer any questions now, and or if you're more comfortable sending me an email, I'm happy to answer any questions via email as well. And I've put it here for you. And here are just some references for the talk. And again, I really want to thank CCSN for having me here today. It really is such an honor to be here to talk about food in a bit of a different lens without the specifics of nutrition today, but I really hope that this felt supportive to everyone and that it could benefit you in some way. Kim, did you want to go to some questions?
Yeah, of course. So if you go to the right hand on your screen, you can enter your questions there. We have some right now. One is, since I started treatment for prostate cancer, my sleep is poor. I used to sleep through the night. Now I may get 4 hours sleep per night. Are there any natural products or food to consume to help with that?
Oh, thank you so much for that question. And I'm so sorry because I know that sleep is so essential at this time. And so there are definitely some things that we can look at when it comes to sleep. And I would say that that could be more of a one-on-one conversation that we can have. Our MDs are also very well versed in chatting about sleep as well, and just generally speaking. So I'm happy to chat with you one-on-one too. So please get my email from Kimberly or on the presentation there, and I'm happy to connect with you that way. But some folks might find that sometimes trying to hydrate a little bit earlier in the day can be helpful. I find a lot of patients come in and they're up during the night to go pee a few times a night. So we try to shift some of the beverages to earlier in the day to relieve that in the evening. Sometimes it can be helpful to give our bodies a bit of time after dinner to digest, and even to help that. Sometimes if you're able to, if you have the energy to, like even a short walk around the house or around the block can help with a bit of that digestion, so our body has that time to do that before we go to sleep. So it's more focused on sleep rather than digestion when we're going to sleep. But in terms of during the day as well, we can look at blood sugars to see how that could be helpful. And I'd love to help you in a one-on-one for some further recommendations for you as well.
Thanks, Erin. And then there's that they became a vegan since their diagnosis. Is there proof that veganism helps with cancer? What foods or minerals do I need to be concerned about while being a vegan?
Oh, yes, great question as well. So we're seeing a lot of trend towards plant-based options. So one thing that I find does happen if someone has switched to a vegan or vegetarian or plant-based diet is that we need to ensure that we're getting enough protein at our meals and from those vegetarian sources of protein, as well as sources of B12 and iron. And we can definitely get all those nutrients through a vegetarian and vegan diet. Sometimes we need to supplement on top of that, but most of those nutrients we can get through our whole foods first. We definitely take a whole foods first approach at InspireHealth. So I'm happy that's something to look at someone's dietary intake and to see if they're getting enough foods through that vegetarian or vegan diet. So I'm happy to as well help you with that if you want to send me an email. And part of that as well is when we are switching into those diets, just to be a little bit kind with yourself again and having a bit of space around that we don't have to be strictly one way or the other. And I find that if someone is we don't have to be vegan or vegetarian, we can be a little bit flexible if our body is asking for a little bit more protein at the time, or if you're choosing that at this moment, this feels like a good food for me, just to be kind with yourself about that. We know that plant-based proteins are amazing. They have more fiber than, say, animal-based proteins, and sometimes more of those plant nutrients. So even as non-vegetarians or non-vegans, it's a really great idea to include some more of those plant-based proteins in our diet as well.
Okay, perfect. And then are there organizations in Ontario similar to InspireHealth that are also free with provincial health cards?
Oh, I'm not sure if they're free with provincial health cards, but I do know that there is the Integrative Ottawa, I'm just looking at the name, the Integrative Ottawa Cancer Centre. That does provide really great programming as well. And I'm not sure if they are covered or not. You might have to reach out to them, but I'm happy to look that up too if you wanted to send me an email.
Okay, and then can you comment on the benefit of pomegranate juices?
Oh, yes, thanks. So we know that there are so many different fruits and vegetables that have great antioxidants, that buzzword that we've heard for a really long time. And we also know that those benefits really come when we have a lot of the fibers that come with the fruit and vegetable. So not that we can't have juices, we can have juices in our diet. We just they are a concentrated source of sugars. So when we're looking at our blood sugar regulation, we want to make sure that if we're having some of that pomegranate juice, that we're having it with a meal or with a snack, just to slow down some of those sugars. And the antioxidants, it's great if we can get it from a variety of fruits and vegetables, and usually most optimally in their whole form rather than juice form, because it has more fiber and other nutrients that we see with it. But again, combining a bit of pomegranate juice into your diet is a great way to get some flavor and get some of those antioxidants in as well.
Perfect. And then someone's asking if there's any suggestions on quick on-the-go bars you would suggest.
Quick on-the-go bars. We have a great recipe actually on our InspireHealth recipe for granola bars, and I do recommend actually making your own. There are some really great recipes online or that I have access to. We have some on our InspireHealth website, and I have some others as well if you want to send me an email. There's a couple reasons for that. When we buy them as like ready form, usually just to keep them stable on the shelf, there's usually a little bit more sugar and a little bit less nutrition in it than if we were to make it ourselves, and it's a lot more affordable to make it ourselves. And we can usually include more protein when we make it ourselves if we put in more nuts and seeds. And so please reach out to me. I'm happy to send you some recipes.
Okay, and we'll wait a minute if there's any more questions. Okay, Erin, would you like to say any last minute words?
I just really wanted to thank everyone for their attention. I know it can be a lot to sit through an hour-long presentation where you can't really see my face. So I just appreciate your attention. Please email me if you have any questions. I'm happy to point you towards other resources if appropriate, or to chat. And again, I just really thank CCSN for this opportunity, and thank you all for being here.
Thank you, Erin, so much. And thank you everyone for attending the webinar.